I'm Laney. I'm a genetic counselor and associate professor at Emory University, and I am fortunate enough to be able to work almost exclusively in Fabry disease. Most of my work focuses on psychological manifestations of Fabry disease, and also I work a lot with the young kids with Fabry disease. And I just feel very grateful that I'm able to work in Fabry disease as a primary disease. So Fabry disease is a pan-ethnic lysosomal storage disease, which doesn't tell you much, but it tells you that it's in everybody across the world, and it tells you that it impacts the recycling center or lysosome of the cell. There's an enzyme called alpha-galactosidase A, and in patients with Fabry disease, it's malfunctioning or not present enough to break down these big, giant sphingolipids, lyso-Gb3 and Gb3. And if you can't break them down, they store up in all the vascularization of your blood vessels, which means they get narrowed, and that leads to organ problems. So in childhood, you'll see burning pain in the hands and feet, you'll see digestive issues, and it just gets to the point over time without treatment that they go into having proteinuria and having heart arrhythmia, and then it continues on to progress to some pretty, horrible end organ things if you don't get treatment. But we have different treatments now, and so we're kind of excited to see how that changes the natural history of Fabry disease. So my presentation, the one that we're talking about, is about young boys and girls with Fabry disease who are in the Fabry registry that's sponsored by Sanofi. And we looked longitudinally at a cohort of kids who were on no treatment, but they'd had assessments over time, and another cohort that started treatment at certain ages across time. And we're trying to figure out if their growth and their weight changes based on being on treatment or not. So it's a pretty simple concept, which is looking at height and weight over time. Do you see a change in growth trajectory by percentile in girls and boys with Fabry disease? So it was kind of a mixed bag. So one thing that we noticed is that there in the natural history population is a slowing of growth at the time in boys with Fabry disease where you'd expect to see an acceleration, right? We all know about the growth spurt that boys have when they hit puberty or a little bit after. It can happen anytime from 14 to 21 where they suddenly grow up in height. Well, in the Fabry disease boys who were untreated, it seems they have a dip where they don't get treated and they don't grow as well. So what we did see in the people who were treated with Agalsidase beta is that they were able to continue growth in a trajectory that we'd expect, which is about a 7th percentile over what the natural history cohort is. So long story short, we see that the kids are following the trajectory that we'd expect for the boys who are on Agalsidase beta. So that was pretty exciting. Then we looked at weight in those same population of boys, natural history versus treated with Agalsidase beta, and we find that earlier, so like in the 2 to 12-year-old range, children who are on Agalsidase beta did actually have an improvement in weight and BMI. And that was known from past papers like Rob Hopkins' registry paper, where we saw that some boys with Fabry disease tend to have lower weight, and then we saw this change from the natural cohort in the younger age. So the weight stabilized younger in Fabry disease boys on Agalsidase beta, and the height followed its normal trajectory as an average kid without Fabry disease when they were treated. The take-home message is that Agalsidase beta seems to normalize growth in boys who are treated over the course of childhood into adolescence. And it tends to impact them starting around 14 years of age to 20 years of age is where you see this increase in percentile growth that is not making them giants, right? It's just keeping them on the growth curve that we'd expect with a normal growth spurt during puberty. I mean, I think it's really important to understand that the only way to know what's going on with Fabry disease in younger kids is to get more data and put it into larger data sets across different organizations. The Fabry registry is a good way to do it, but you can also do it with collaboration around the world between investigators with kids who are treating kids with Fabry disease. And I think the goal is to see if we can improve the lives and quality of life with kids with Fabry disease, and believe it or not, height factors into that a great amount.